Good morning, welcome back. Well, there are more than 200,000 cases of heart failure in the United States each year.
And joining us this morning from Gunderson Health System to discuss ways to prevent and monitor heart failure, Dr. Julio Bird. Dr. Bird, thanks for joining us this morning.
Thank you very much. Good morning to you.
Now, the last time you and I spoke, we were talking about mountain climbing with regard to Mount Everest, but I got to imagine that battling heart failure and coming back from that can kind of feel like a mountain to climb for patients who have gone through that.
Oh, absolutely. Climbing on mountains brings about many of the symptoms that people feel when they experience heart failure. So it is very much a parallel situation.
What are some of those symptoms of heart failure?
Well, the basic reason is that the heart failure sounds like a pretty harsh term, and it's not an F. The heart is not getting an F. It's getting maybe a C or a D. And basically what's happening is the heart as a pump is not being able to keep up with the oxygen and blood flow demands that the body requires. So the symptoms are caused by the fact that there's not enough oxygen being delivered to tissues in the body, and that brings about fatigue, shortness of breath, etc. Now, when it gets bad, the heart failure, then the blood starts backing up into tissues, and it causes swelling of the legs, maybe swelling of other parts of the body, as well as fluid in the lungs, and that's called pulmonary edema, and that is the worst probably manifestation of heart failure. The problem with that is if untreated, things can continue to get worse, and it can shorten life on that basis.
Yeah, so what are you and your colleagues at Gunderson doing to kind of monitor these symptoms and help heart patients?
Well, we have an excellent heart failure service, and again, in the past, management has relied mostly on conversations with the people suffering from it, finding out exactly how limited they are, finding out on the basis of clinical symptoms, how they're feeling, trying to guess what the pressures are inside the body and within the lungs to see if there's any chance that fluid could be accumulated in the lungs or elsewhere.
Right, Dr. Bird, there's obviously no cure, but these are ways to monitor and at least kind of check up on it, and obviously let your doctor know if you have any other questions and concerns. That's all the time we have this morning. Thanks for joining us, Dr. Bird.
Thank you.